Healthcare providers can wash and disinfect their hands over 100 times a day. When they're not scrubbing in for surgery, here's the 3-step protocol they follow to protect their hands from drying out. Step 1. Washing the hands with Bactilin soap, which is specially designed for frequent hand washers. It has the same acidity as your skin, which prevents resident skin flora from falling off. These resident bacteria, viruses, fungi, and even mites help protect your skin from pathogens, prevent excessive water evaporation to keep your skin moist, and even help wounds heal faster. However, since Bactilin does not have any antimicrobial ingredients, it doesn't disinfect the hands. So in step 2, sterilium is used for disinfection. It's an alcohol-based hand rub that kills pathogens without significantly harming the skin microbiome. It also contains a moisturizing complex to prevent the skin from drying after repeated use. Finally, Bactilin Balm is used to soften and moisturize the skin. It also soothes any redness or irritation caused by vigorous washing. Damaged skin is at increased risk of pathogen colonization. So looking after the skin is an important part of hand hygiene.